mais voilà, je t'entends quand même. Voilà, bonjour et bienvenue à tous pour ce séminaire du Centre de recherche en approche sociale de la santé. Désolée d'être à distance, j'avais une formation à Jean Blou jusqu'à 12h25 et donc impossible pour moi d'être présente physiquement aujourd'hui. Donc j'ai le plaisir d'introduire le séminaire que Sandra va nous présenter au sujet de la responsabilité en santé publique sur Internet. Donc c'est une présentation qu'elle a préparée en collaboration avec 4 autres professeurs. Donc je compte sur toi Sandra pour me compléter ou corriger dans la présentation que je vais en faire à l'instant. Donc le professeur Richard Ricciardi de la George Washington University qui est doyen de clinique pratique et d'engagement communautaire. La professeure Azucena Santillan Garcia, bon alors vraiment là, désolée pour la prononciation, qui est professeure à l'université de Valence. La professeure Anna Azurmendi, qui est professeure en droit des médias et doyenne de la recherche de l'école de communication de l'université de Navarre. Le professeur Hildegard González Luis, qui est professeur à l'ULB et qui est collaboratrice du Centre pour les politiques en santé de la George Washington University. Voilà, Sandra, je te laisse volontiers la parole. On t'écoute avec beaucoup de plaisir.
Merci beaucoup, Céline. Je ne sais pas si le partage, c'est correct maintenant. Est-ce qu'en distanciel, on le voit?
Le partage d'écran, c'est déconnecté.
Attends. Ça marche? Maintenant, en distanciel?
C'est bon, c'est très bien, merci.
Cool. Donc, voilà, bonjour et merci. Juste pour clarifier, cette séminaire, ça va être donné en anglais parce qu'il y a des collègues qui sont en distanciel. Et donc, voilà, c'était, je pense, le but aussi de cette présentation et qui vient d'être déconnecté de mon deuxième écran. Donc, good morning everyone to all of you and to all of you that are online. And it is my pleasure to be here, so thank you for inviting me to present something that is a bit different. So my purpose today for you is just like to bring you somehow outside your academic comfort and to push you somehow to think differently about the use of social media and the responsibility that we have as healthcare professionals, our academics, students, and so on and so forth. So this seminar, as Céline has rightly expressed, had a second title, so it was a bit more catchy. And indeed, I will invite you to think about your academic footprint and all the information that we're sharing as professionals, but also as individuals. And this is something that we really need to think about. For those of you who know me, of course, this is not my main research. My main research focuses on mental health and also addictions and the consumption of tobacco and alcohol within, innovation in healthcare, of course. But I think it's important. It's like I have a very curious nature, and sometimes very interesting proposals might land into my desk, and this was one of the examples of the collaborations that I'm about to show you. So this collaboration, as Céline explained, entails from ongoing work that I have been doing at the University of Navarra, but also with the George Washington University through my colleagues that were just presented. Céline mentioned their names, but I will just briefly give you or put the face of who is who. So Richard Ricciardi He's a professor at the George Washington University. He has a special role in dealing with health policy and media, and I think this is an interesting view. Athena Santillán Garcia, there you go. She's a professor in nursing at the University of Valencia, but also she's one of the responsible advocates at the Ministry of Health and Science for placing and dealing correctly with what type of messages we are doing. This is really important, and she has been voted as one of the top 5 most influential nurses in the world 2 years ago. So that's really interesting, the way that she's managing media and the presence of well-curated media. Then Ana Sormendi, she's a professor in law, so she's the dean of research at the School of Communication of the University of Navarra, as Professor Hildegard González, who is, if you want, the initiator of this collaboration. And she's a fellow at George Washington, and then me when I was young and not too stressed out. But we work together on this proposal that I'm going to just show you. So for this session, what we are going to do, I have prepared 2 strands, and one, I will give you a bit more of context on how can we use social media in the public health context, and then I will present you our recent research, which is a series of systematic reviews. There's also the link, of course, with this research. And I will just give you some preliminary results of one of the 3 strands that we have analyzed. And then, if you want, and if you still have some food for thought, I will give you share some advice that we have recollected through this research. So this is a bit the session. And why are we interested on this? We're very interested in how do we communicate. We are in the academic world and we are pushed to publish or perish. But we also have been, encouraged to be active in media and interact with media and be able to pass the message and to be relevant, because I think our institutions they are placing a lot of emphasis on being there. But this comes with responsibility, and we are going to see some examples of professionals that have been banned and have difficulties in the way that they dealt with media. And I will take you through some of the examples that we can see and we can discuss later. So I will just pass to the first session, or the first part of my session, and I want to, of course, we are in a public health context, so I would like you to think with me about some of the basics. So, of course, we know what social media is, but sometimes there are nuances that it's better to clarify. So when we talk about social media, we know about these online platforms that are widely used, but maybe that we need to pay a bit of attention. What is interesting is like the information goes very quickly, and then we are very able to share information on different ways. And nowadays you're going to see the evolution of the interactions and how do we interact with on a more modern way, on a quicker way. So some of the common features of these interactions include profile creation. Probably you have different profiles, be aware, and we will discuss that later. Content sharing, interaction, and this is what we are seeking, but also updates, messaging, and communication. And this is where I want to place attention. When we talk about social media and social context in the public health context, we know, and we cannot deny, unfortunately, that this context has become a source of information, and that is dangerous because there's exchange, there's influence, and there are elements that need attention. What is interesting is like today, well, in December last year, we identified more than 4.6 billion of social media users around the world, and I will clarify that later. There are many benefits to use social media within context, and we will talk about that. For instance, preventive behaviors, working with specific communities, and enhancing some aspects of health. We will talk about mental health and sustaining information. But then there are also notable harms that we cannot deny. So, for instance, very recently during the COVID pandemic, we saw some of the influence that some of these messages might have. So, of course, we might see a decline in public trust, and that is important, and because we don't know who's mediating for this information. And then we have seen deteriorated mental health because of the interactions, because of the harassment that is going to also appear later. And this has profound implications for us as professionals, as academics, and as users, and as students, of course. So that is, if I ask you, what are the most common social media platforms? Of course, you have some idea in mind. Maybe you won't use all of them. I don't know all of them, but these are like the most common, apparently, social platform media. But these are the most commonly used. And I encourage you to think whether you are active users of some of those and the way that your data is going to be treated. When we think about the figures, what I think is interesting is like this is a very new phenomenon. And if we look at our students, many of them are about 20-something. So that means that over the past 20 years, this has changed very quickly, and this has become imperative in our daily life. So by the end of 2023, I already mentioned it's almost like 5 billion people users, and this would be increased up to 6 billion by 2027. There's a clear intersection with public health for good and bad. I'll show you some examples in a minute, but these are very powerful communication tools. The problem is like neither our academics nor our students and future students are yet trained to how to make a better use to do that. We are trained to how to publish an article, to how to conduct research, but not necessarily about what is the game of social media. So, of course, we know also that misinformation is essential, and we have a role to play on this one. When we look at the data, that we know that it has exploded. You have the most common social media platforms, and that is fine. But what I think is very interesting is like what happens, and again, we talk about inequalities within different settings. We know that users have exploded in our context, but what happens in other low and middle income countries has really increase dramatically. So they passed from 34% in 2013 to almost 60% in 2023, and this is clearly increasing. The problem is that these might be used as a source of information, reliable information, without much firewalls, and this. When we talk about the benefits and the harms of social media, I will just give you some hints. And of course, I won't go into detail. And if you're interested, for sure, you will have this presentation. But positive would be that you have a very direct access to information. And quickly, we can find information about diagnosis or about specific situations and so on. And it builds community very quickly if you find your peers. Of course, on the other hand, you might also very quickly not realize that dangerous information spreads very quickly as oil, and this is really interesting. There's very few firewalls for fictitious information, and how do we deal with that? And of course, there's other dangers like compulsive disorder, and this is something that is also interesting for me. When we look about health promotion interventions or healthcare provision, these are important tools also, and that is, for instance, we know in the context of tobacco that the companies have been using very aggressive but very attractive media to catch the attention of users, to catch the attention of young users, and the firewalls are not working. That is clear. But then, if people are educated to look for good sources, evidence-based guidelines can be very easily distributed, and then we can help potential consumers or users about one or another therapeutic options. That is also very interesting. But then we have to see on how messages are distributed within these social platforms, and that is interesting. Also, in terms of healthcare provision, there are important implications for instance, in healthcare departments, in hospitals, and so on. And also, if we think about healthcare provision, think about the damaging that a comment or a testimony that is not accurate could have in the presence of an institution, of a hospital, and that is also important. My favorite example would be the pandemic and other emergencies. Quickly, information was distributed during COVID times. We were all at home, and this was a very easy way to interact with information that we could not verify whether this was correct or not. You have heard of fake news and the way that this message was transmitted. With nuances, that was also important, because the rapid spreading of false information was an issue, and is still an issue. And we can look at different contexts and different countries and see how the different governments are dealing with this. To bore you too much, I just want you to think about the benefits or harms of social media. For instance, in the case of mental health, that is really discussed by the literature. We will find competing information, of course, but social media has been used, and you see some TikTokers, as I've been told, that promote or discuss some diagnosis, and this is important. How much validity do we post into this information that we are seeing, or that our users are consuming? This is for. What I think is interesting is, like, if we think about the benefits of improved global health linked to use of social media, we know that it's a way of sharing information. And we have, I'll give you some examples. For instance, in the case of the COVID pandemic, if we look at the data, we know that almost half of the American citizens had looked actively at social media for exploring some information related to vaccines or how to behave in this context. We know that social media is a promoter of preventive behaviors, and also, for instance, in the case of health officials, they quickly can distribute their information. And we know that it helps to increase health literacy, which is very interesting for many of us. And what I think is also interesting is, like, in the case of Ebola or in the case of COVID-19, it was like really a big instrument, well used to deal with uncertain truths and to distribute information in this way. So we know that it enhances awareness and enhances preventive strategies, and these we hinted at the potential positive effects on mental health and resilience. But there are also harms with the use of social media. And I'll give you some examples. There are plenty, and we will stop until tomorrow. But I will just discuss some examples. Of course, the more typical one would be the context of vaccine hesitancy. We will talk later on with another nuance. But here we know that vaccination or anti-vaccination movements, they were really attentive, and they were spreading a lot of misinformation in specific platforms, and that is really clear in the literature. When we consider, for instance, some of the use on YouTube and some groups that advocate for or discuss autism spectrum disorder, we saw also that most of the information was discussed by non-professionals. So there were no medical background, no information, just like feelings and sharing information that, of course, if it's not critically received, then they will be really taken for granted as correct. In Japan, we have a very interesting case that we saw also recently, and actually social media was at some point weaponized or utilized by anti-HPV vaccine groups. So the Japanese government had to react very quickly and proactively recommend and actively use those sources to counterbalance this disinformation. So they kind of went into the game in the social media, and that is really interesting. Another very dangerous element, it is the harassment that some of the professionals, like medical doctors, nurses, you name it, or academics might have by interacting with social media. And that is undermining authority, personal attacks, and this becomes a very dangerous game. So this is really important. And we know that linked to that, but also to being present in social media, I spoke about the very benefits of using social media, but here we know that it's also linked to some harm. And how does it causes harm? Probably you have heard about this famous algorithm that it recognizes your likes and your clicks and the pages that you are interacting maybe by mistake, and that is important. We know that more posts and those that are a bit more controversial are going to seek more attention, are going to get more attention, or they're going to use specific colors, and that is consequently those algorithms are going to push for those messages that are more polarized, that are more challenging, and you might position yourself right or left, but still you're going to interact with these. Another element that social media, I will pass it on to you, but I would like you to think about the addictive nature and whether you can actively say, I'm going to stop, and we know that it has an effect on neurochemical responses, and this is a clear discussion, and then it prevents user from not returning, so it encourages interaction, and that is important. Another element that is very important, and I will briefly note at the end of this first part, is the social media companies' responsibilities, and these are negligent. We work, as you see, this is a multidisciplinary group working, but the law is very important, and this view on the law and the rights of behavior for these companies, we know that clearly they are negligent, that they support their business, and they could make some changes, but they don't. Now things are changing, and I will give you also some hints. What do we do? How do we deal with this? What are the strategies to promote benefits, but also counterbalance some of the harms? We hinted only at the many benefits, and we need to seek interaction and good interaction from users, of course, by creating awareness, by supporting users, and so on. But we know also that harms can be avoided, and how could we do that? The literature is very clear, and we identify like 4 main pillars for doing that. So how do we maximize these benefits? And our attention is diverted to social media, governments, but also users and civil society. That will consider them as one. Social media companies, like in the case of Facebook, which you might have heard, during the pandemic, he was really targeted because it was clear that they were not modulating some discussions. And they were given some clear information from authorities in saying, okay, maybe you need to act, but they chose to react rather than engaging and so on. And then we have seen some changes in the law, notably and interestingly, it's the European Commission who is one of the leaders in this action. They passed a law in 2022. This has been amended last week with the Digital Markets Act, and it's really interesting how they are leading in this context, and how they are putting the responsibility to the social media companies, in Facebook, Twitter, etc. You need to ensure that this is a safe environment that is not distributing incorrect messages, or, for instance, supporting and encouraging harassment or inappropriate behaviors. Governments, of course, have a say in how they do and how they create their policies, and how they emphasize the importance of goods practice. And we will see this also in the second part of my presentation. But users and civil society, for instance, I think in Belgium, is particularly interested in the role of civil society when it comes to reaction and to movements, and to asking for specific support in this context, also in the use of social media. So I see users and civil society as a common front, and this is our ongoing work that really we will see some results soon, but there is still a lot of discussions going. So if you want, for this first part, the conclusions that we would like to pose to you is that, of course, using social media is a dual-edged tool. There are many benefits there, but you need to use with caution, and this is important. Using this offers many important options for researchers, for students, for academics, but we need to know the rules, and we're not so sure that there are rules that help us to do so. Then also, what I think is important is, like, we need to know more. I think, of course, being in the academic world is also, we need to do more research, but clearly there is a lack of comprehensive studies, and we are just like adding a small, if you want, grain to these very growing, rapidly growing fields. This is also important. And last but not least, we all adhere to this first do no harm. But I don't think this is necessarily been the case in this context. So there is a fundamental swap that is needed in order to reform policies, to create new policies, and to implement much stronger control measures towards improving and using this appropriately in the context of public health. So this would be, if you want, a small introduction to our consideration of the scientific literature. What I want you to do now is just to think a bit about your own interactions. If you have a mobile phone and you want to play a bit with this presentation, please do so. I won't share the details now with you, but I will share them later on. Of course, this is anonymous, and you will be identified, but it will also give us a lot of information for the future, because sometimes it is important to know that we are not so aware of the way that things are working. So you will find 3 questions. Feel free to respond or not. This is, of course, totally voluntary, and see if this suggests to you something in the way that we are interacting. No worries. I will later on pose you some challenges, but I hope it works. It was working this morning, but you never know. This is Murphy's law total. Is it working? Ah, good. Perfect. Okay. No worries. I have a plan B. So it's a plan B. Good. Just if it's not working, no worries. I will reshare, and I will send you the questions. We will see them later. In the second part, this is like the more academic, if you want, research or traditional research that we are doing, and this is a series of systematic reviews. We consider freedom of expression. and position yourself as a user, as a clever cookie that has a lot to say. And how do you pose your message? You also have a responsibility as a professional and as a head of department, or as a, as a very relevant figure, or as a student, as a potential, leader. And this is important. When we talk about freedom of expression, and this is it's not a particular term that I like. We have discussed this a lot, but we came to an agreement. And we will see that this is the key term for us. We have seen that social media, here we focus also on traditional media. We know that it reaches larger audiences, and we wish to also sometimes influence public policy. But sometimes we see a lot of unprofessional practices, maybe not intentionally, but this is not an excuse, because what we have seen by looking at the literature is that this might lead to severe sanctions and things that you might have had, or interactions that you might have had or done in your past life. They might have a sanction because you are a professional. And this, of course, this will be discussed. A bit of background, you know that this freedom of expression is recognized by the European law, by of course, all the constitutional law, well, not all, but the Universal Declaration of Human Rights since 1950, and this is an abstract way, but this is important for us to know. What does this mean? This means like we all have the right to criticize and to pose your own opinion, but you really need to do that within a context, and that is important. This promotes active engagement of citizens, but it also faces some restrictions. And I think sometimes, and I think also in this context of social media, we think we have more rights than responsibility. Important. So attention to us, because of course, being in such a context, and this is where I wanted to go from this element of freedom to express yourselves, can lend to credibility, because you being a healthcare professional, your authority, your person as such leads to a certain credibility concerning health, advice, and treatment or other hospital-related issues. If you are broadcasting on TV or in social media or in the press, and you have a moral authority, and this is good, but you have to also exercise it with caution. And why is that? Because if you are in this context, you're dealing with a very sensitive issue, that is human health. And also because of the many challenging consequences that a bad advice could have in a topic that we are discussing or that we have at hand. And this might, think about your own topics of research. Imagine that you are invited to talk about, I don't know, whatever your research topic might be, and you're very passionate, but actually you are sharing some information that is not correct 100%. This might have an important impact. Now, since my other QR didn't work, let's think together. Have you ever Googled yourself? Please confess. Are you happy with the results? Because I'm never happy with my picture. Like I should look better, but I don't have the time to. And where did I get this picture from? Have you ever posted information, for instance, about a patient or a placement or Facebook or Twitter? Or, for instance, have you ever checked whether there's a social media policy of the university here, of ULD? Have you ever checked? No? I encourage you to do that. For people who are working in practice, have you ever been tempted to add patients at social contacts or social media contacts? And that I had this question a few weeks ago when I was lecturing in Spain. I was like, oh my God. So that's important. And also, I'm sure you haven't, but have you ever made a public comment very quickly, with Spanish attitude, like quickly reaction, and then it's like, oh, that could be considered offensive at some point. The other questions that I have for you is like, at some point you might have likes and then quickly unlikes a comment that it was supposed to be funny, but actually it's not at all. It could be derogatory or it could be considered offensive by you know, in other contexts. And and the final one that I will focus or I'll discuss with you is: have you ever felt that a friend or a colleague has posted information online that might be actually resulting on consequences for them, but also for you, because you are part of the same context, and this is important. And these are not my questions. These are questions that are posed by the Australian Medical Association, and in helping us to think about more about that. So that is the context that I think is important. For us, in this series of research or systematic review, we wanted to give an emphasis on the scientific role that we have. And these were some of the questions that we were considering. So how is it my autonomy of expression as a professional guaranteed? Is it guaranteed? Is it regulated by law or not? In which context and under what circumstances do we know enough about that? So we have decided to focus on healthcare professionals, different types of healthcare professionals and academics for these series of systematic reviews, and I'll quickly go into the initial results of the first ones. And then also what I think is important for professionals in all contexts is to know what are the contractual implications. Did you ever, because this might be very easy to interact, but there's also a contract and a breach of contract that could happen very quickly, but not knowing does not exime you from a responsibility, and this is the message today. This is really important. How are your interactions safeguarded in this context? So for us, the aim is like to attract attention and to discuss the ethical, but also the legal and professional opportunities that might highlight some of the risks involved with those interactions. And we want to, of course, highlight the relevance of conducted research, but also on if there are no guidance, and there you go, a scoop. There are very few guidelines. We need to generate good guidance for professionals and so on. Traditional presentation. So we registered. This is just the first strand that I was presenting, which will focus on nurses. And why nurses? Because these are the largest working force, and I think they deserve a good observance and treatment. So we register our systematic review, and then there's 2 papers that are published, and a third one that is embargoed, so I cannot share with you. But there we reflect about these rights and obligations and responsibilities, even if we are not aware of that. I won't go into detail. That was just like classic searches, all classical databases, but also including law databases, because this is not our traditional way of approaching, but that was like really discussed. Then Boolean keywords and accepted headings, and we had 6 reviewers, and in this case we included 4 languages. What's very interesting is like we were really assisted by the George Washington Library, and we had a librarian helping us in validating all the equations, but also in managing some of the data. So that was really very, very interesting as an experience. We focus on codes, on laws and guides, and institutional guidance and university guidance also. I'm not paid by social media, and I'm not paid by Covidence, but if you are in the realm of doing or ever considering doing a systematic review, Covidence is really interesting, and there's a free version for those who might want to use it. So that was really I can advocate for that if you trust me, and if you don't, of course, there are many other options. So this is what we use. Traditional Prisma, if you want representation for this information that I'm going to share, and of all the literature that we managed to review and to extract data, we obtain a total of 67 hits. That's where, and I will quickly hint here for the last 15 minutes of my presentation. So when it comes to reference frames, so that was like what we wanted to know. In the case of nursing case, so far we have not identified a frame of reference that incorporates these three big pillars. So that is important. There are several contexts that are more attentive. No surprise, US, UK and Canada. In the context of the Belgian legislation, we could not find anything. In the context of Spanish legislation, it's really also a lot of work to be done, and that is really important. I will show you some examples of, but what is it not correct, and why were some nurses or some healthcare professionals punished, sanctioned, and prevented from exercising their profession. What we saw is like some hospitals timidly are creating some initial guidance, and this is really interesting. It doesn't come from the boards, for instance, from the medical association or from the pharmaceutical association or from the nursing boards. It comes from the hospitals. Why? Because there is reputational damage to some hospitals through the professionals that are working there. The same as it will happen if, I don't know, tomorrow I start spreading false theories through my Twitter that I cancel, so no worries. But these would also link maybe to my community approach. So that is important. This should not be here, so that is fine. But just to emphasize some of the initiatives that we are, and why are we focusing on this role that nurses really should be careful on these cases. How do we evaluate those specific cases? We went into all the information that we had, and then what we wanted to know is like if there was a breach of guidance or a breach of trust. Then there are boards that are going to be contacted in those contexts that I mentioned before. So there will be a detailed assessments, and then some professionals also would decide whether further action is required. Those bodies, they have a duty of care, and this is important, and also for reputational purposes. So this is clear, but they do not carry official monitoring of what is happening, because it's impossible to screen all the interactions that are happening. On a real life. You might be interacting, although you're very well behaved today, but if I'm in class, I know that the students are interacting, although I'm sure it's only professional material that they are dealing with. But anyway, that is also very important. So there's no way to officially monitor, but there is a way to be sanctioned if someone else is going to report. I'm going to give you an example, and this girl has been, we have just written another article and an interesting methodology, but that's for another coffee or two. And this girl was really, in the Spanish context, the victim of her own initiative and the victim of a social campaign, very contextualized and charged with lots of emotions. In the context of COVID, but also in the context of the Spanish Catalan independence, and there were so many elements that came at place at the same time that it was really, it merits a reflection on its own. So I mentioned the UK, and I'll give you some examples. So the UK body, and the most well-known body, the only actually, is the NMC, cautions the risks. You need to be mindful, a very UK approach also. mind your interactions. And here, what do they pay attention? What do they encourage their people who are registered with them? Sharing confidential information, of course, posting unauthorized information, pictures, inappropriate comments. But that is again linked to freedom of expression, building relationship with patients, or stealing personal information. But you might think, okay, but this is common sense. But common sense, forget it. It does not exist. The American boards, through the boards of nursing that are linked in every state, what they do is they speak about sanction. And that is important. And you see in blue what are the elements that we should pay attention. But I think what is more interesting is like in red, what could happen to you if you are considered to be guilty of misconduct. And yes, this could be a reprimand, this could be a sanction, money sanction, heavy sanctions. But you could also lose your license to practice. And this is very important in our context. And then also the American Nursing Association goes into discussing, and then here we see the role of students. So students, they are not exempt from being professional. And for instance, in the case of the University of Navarra, my colleague, the Professor Hildegard Gonzalez, she really works from the first year with the students in how should they interact with social media. And there's like continuous exercises for them to be active in social media and traditional media. And then you see some articles published, like for a first year is really good, but also being very attentive to what they should or they should not do. And that is important. I already mentioned that unfortunately we have, or fortunately we have a lot of work to do in Belgium, but also in my home country in Spain. That is important. But just don't worry, I see your energy levels. 2 more slides. This is for everyone. Being a healthcare professional, a nurse, a midwife, a researcher, whatever. We need to know what is best practice and forget about your common sense, because sometimes in very heated discussions we might react, and the problem is like, as the title or the subtitle of this presentation, your footprint cannot be erased, and this is important for you to know. So awareness is important, and definitely, as I was mentioning before, we need to be aware, but we need to share this awareness with all of us, but also with the students from the very early stages. So we are going through this exhaustive analysis, and we will see probably some discrepancies between the different bodies and the different type of professionals. But what we are more interested is like in the analysis, in the content analysis, and see whether we identify some similarities or some differences, and towards creating this comprehensive code that we know so far for the context that I just presented is not existing. So what is the conclusion before I give it for some food for thought or some examples or some good advice, I hope. That is, we know what we have seen from part 1 for 2, there's a very clear lack of guidance. We don't have, like a clear code for us on what can we say, how can we say it. So therefore, there is a clear need for this framework. And we need to integrate that into our curriculum. We are telling our students here, okay, you have to publish, but you also have to distribute and to attract people to your published articles. No, I see that a lot with my colleagues in other contexts. Oh, we just published this article through Twitter, they're in Twitter, they're in Instagram, they're like being creative, and sometimes the balance, I think, is not there. So that is important. And my final comments as conclusion would be that really the need is there to be explored, but if we want to contribute also to better public health outcomes, it's really interesting. And then focusing on us as users, but also because we cannot avoid the interaction on digital and social media, and that is important. final word, and then I don't know if you have some questions. What I think is very interesting is like to keep this somewhere floating in your minds when you are interacting, or if you are ever interacting with in social media or in traditional media, it doesn't matter. You need to behave with certain professionalism, and that, of course, brings balance, and also focusing on the quality of the content that you are going to use. Of course, we know that reactions are very quickly, and you need to be very fast, short, and creative, but also you need to use social media to pass a thorough and clear message. Think also about your engagement not only with society, but also with a specific institution. Are those messages representing your institution? Are you advocating in the right forum or not? Think about your private settings. I don't know if you're familiar with your private settings and with your cookies, but your cookies are being spread and shared happily. So don't feed Facebook, don't feed the big morons of social mass media. This is important for you to be aware of your own privacy settings and how much Alexa can hear you at home. That is also important. Balance professional and personal. If you are a heavy user, but allow me, not a heavy user, but if you use these a lot, at least have a private profile and a personal profile, and a professional profile. You will be linked because this is the nature of the beast. So yeah, it's a certain if you want impose censorship, but this is a game that unfortunately we are at the moment. Of course, ethical sharing and just be mindful of what the things that you are sharing, but also be very active in the many people that you can link with. I didn't mention LinkedIn, but I'm not a big fan, but network that can be done very quickly and into building new relationships. And also final suggestions. Be consistent on the type that you work. Sometimes you have published an article or two in 1 week, as some people might do, related to heavy work, and that is great. Imagine that through this success we are bombarding for very actively in the media. Then this is going to be overwhelming. So this is also prepare. You can prepare your post if there's a sequence. You can really use that in a more professional way, linked to your critical thinking. And then I will stop with not the last, but the pre-last. This is a continuous learning that is clear, but by being social media, as by being in life, there are conflicts and there are different views. And this is important, is for you to think, how can I deal with this conflict? Because you will have people that are going to be very aggressive towards you, that they're going to question you as a professional, as a researcher, as a PhD student, or as a whatever. You know that anyone that is in the public arena is very heavily criticized and sometimes not used in the best ways. But how do you deal with this? Sometimes harassment is very important, and it says a lot about you and the skills that you have acquired in thinking about this professionalism. That was my first point. So I think I have accomplished my task in 54 minutes. My social media tells me, and I will finish where I started with your digital footprint. I hope this quick session has at least highlighted one or two things that you were not aware of, that you were aware but maybe you didn't consider, or you saw it differently. And finish with this short advice. I will leave you with some questions and answers, and if you want to have this presentation, especially the final part, I will give you some key tips for later. But before, if there are any questions, of course, I will happily or comments, I'll happily take them. So the floor, I think, now is yours. And thanks for listening. Are there any questions or comments? Is it something that you use social media actively to share your papers? Are you afraid of using it? Yeah. Now.
I have one question.
Yes.
Do you have any idea of what you need to activate the right to be forgiven? Forget? Yeah.
Forgiven. Forgiven, no, forgotten. You could be forgiven, but maybe not forgotten by the social media. Yes, there is a procedure. It depends on the cases, and then of course the process is very difficult as it happens, and this is why I'm insisting on be very mindful, because imagine that I, which is not the case. I was partying, I don't know, 10 years ago, and posting stupid pictures online. And then when someone happens to, I don't know, to find these pictures, I was like, ooh. And there's some damaging people out there. So you might be shocked, but this is you. And then you might contact, for instance, if it was in Facebook or in any other social platform, you really need to start a procedure to contact their services that are online, to really follow all the steps so that they will revise your case, and there's specific guidance for the cases that they might consider that they might delete this access to this picture or specific comments. But this takes a long time, and I won't say in all cases, but in the most heavy cases, it's linked to you know, more heavy cases that are, for instance, in courts, and then there's a decision, a judge that is saying now you need to act. But as an individual citizen, it's a bit tricky. Not always the case, no? But we see the many difficulties that this might have. For instance, in the case, this has nothing to do with research, but imagine that you had a fine and the Spanish ministry, then everything would be to be seen. And yeah, and you were stupid and 18, I don't know. And then, but this is part of your social footprint presentation. So I just encourage you to create these, but you can't prevent everything. So that's, it's just a different context. Yeah. Good. So everything is either clear or unclear. That is good. You have a question, sorry.
Yes, thank you. Are you aware of how digital epidemiology works?
How the digital print works?
Digital epidemiology.
Okay, digital epidemiology. That is unfortunately not the topic of my presentation, but I don't know, clarify this question.
Because I've read that they use what we share on social media to manage or to prevent, to collect information about disease, and so like COVID-19, for example. They take information on social media to prevent the disease burden or something like that. Okay, absolutely. If I understood your question correctly, and as I mentioned in the first part, you know, at some point, for instance, in the pandemic, information was needed very quickly, and social media and epidemiology and data was like really needed in order to take decisions. But when I was really cautious, and what my emphasis was like at times we could not guarantee that the information that we were sharing was correct. And of course you need to go to the good sources as you normally do, but still like health policy officers were sharing information through you know, their official channels. So I think it's the criteria of official channels that you are going to be able to go through well-screened, curated data, and that is important.
Of course, it has a role, and so it needs to be created. It needs to be good quality. Yeah, so that's okay. So yeah, good. I leave you to the sandwiches then. Thank you for being here, and yeah, good luck. And if you have any doubts, I'll share the key facts if there's of any guidance. So thanks for your interaction, and yeah, to the next one. Yeah. I don't know. Okay, 1 second. Sorry. Are there any questions, Céline?
Yes. Thank you. Il y a un écho, simplement. Thank you very much, Sandra. This was a very insightful presentation. And yeah, I would like to share a comment or an experience. During the COVID, with 3 PhD students, we interviewed 40 health professionals, and mainly in nursing homes. And we stated that a lot of them created groups on some platforms like WhatsApp. Firstly, it was to exchange information on safety guidelines. But after that, they used these WhatsApp groups to share personal information on patients they had in charge. And the goal was to facilitate the caring. But of course, these groups are not entirely public platforms, but it raises a lot of questions about the confidentiality of information, of course. And also, we don't know if these groups have been regulated afterwards, or if they are still in use. So I just wanted to share these comments, and yes, do you? Is it also interesting to have different guidelines about different kind of platforms also, so that health professionals are fully aware of the risk that are at stake in these questions?
Yeah, thank you, Celine. I mean, I think this is a very interesting case. I was not aware, but I think even you all go to WhatsApp and check your traditional message. Your messages are encrypted, so no one can breach this discussion. But I think the most obvious breach would be someone that gets upset about some of the exchanges, takes a print screen and shares it, and then I won't use a bad expression, but you know what will happen. So you are never exempt from your responsibility. And yeah, this is the typical example that something that starts with a very good will becomes quickly, because of the timing and but this might be very. I think in reality, it's a very negligent use of data, of very sensitive data. And I think if there's someone working here on this type of topic, it's very clear. And for instance, in the Belgian setting, we're not aware of any specific guidance, but if had this happened in the States, for sure there will have been a sanction, because they are interacting, I mean, they are sharing information from patients within a channel that is not made for, even if there is a very good will in the purpose of sharing. But this is a very interesting case that you're mentioning. Yeah, thanks for sharing. I was not aware, but this is clear, the type of example that we need to pass. We need to encourage our colleagues to think about the things that we are sharing, even if we think this is neutral and well-intended. Because there could be some consequences, but we won't say anything. So, thanks, Celine.
Yes, thank you. I hope you will share with us your article.
Of course, with pleasure. Maybe the first one. We're just like, as soon as it's out. Now it's the final editor, so yeah, good. Okay, so thank you so much. I leave it to you. I think there's plenty of nice sandwiches here, and thank you everyone online for being connected, and yeah, see you soon. Bye. Thank you.
Bye everyone.
Thank you, Sandra.
Bye, thank you.